Yes, hello, welcome everyone. Welcome to another live session with the Flow Coaching Institute. Today, we will be talking about where does coaching end and therapy begin, the differences between coaching and therapy, and the common ground that both practices share. And I have two guests with me, wonderful guests with me, Victoria and Des, and they have, both of them have both therapy and coaching practice like myself. So we will be doing our best to give you clarity about the confusion between where does coaching begin and therapy end, or vice versa, and when should I refer my clients to a therapist, or vice versa. So we will be answering your questions. We received already some questions, a lot of questions indeed. And then, of course, as you listen to us, please feel free to engage with us. If you have any comments or insight or questions, you can type your questions in the chat box, and our MC, a tech person, brings the questions instantly, and then we answer those questions as well. Or Doesn't have to be questions. You can engage with us through comments, insight, or maybe you would like to share some experience. We would appreciate that. We would like that. Wonderful. So, Victoria, why don't we start with you? Why don't you introduce yourself and also maybe give some background information about what your therapy practice is about and coaching practice is about? And then Des, and then
Awesome. Thank you. My name is Victoria Sanders. I'm a licensed marriage and family therapist in California and also in Utah. I am also a Flow certified professional coach. And we opened our business quite a long time ago. My particular area of focus with regards to therapy is with foster and adopted children and their families. My primary area of specialty with coaching is actually with female entrepreneurs and helping them to build their business. That's something that I'm super passionate about. I made a lot of mistakes and when I was building my own business, and it would have been really nice to have someone there to support me. So that's kind of what I try to do. I'm also really thankful that part of my practice, I do have other therapists who work for me, but I also have a portion of our company that focuses on coaching foster parents and what we call in California resource parents, but foster parents is what they're more commonly called. And so I have 4 coaches that work underneath of me as well. And they all have gone through the flow process. And so we're super thankful for that. Because one of the things that I think is most important to me when we think about coaching is that there's some training, that we're not just calling ourselves a coach, that there's training and explanation and understanding. So that's one of the reasons that I'm here today, is to talk.
Yeah, thank you. The key is in the word professional, right? To distinguish, like, there's coaching and then there's professional coaching. They're all professional coaches. Thank you, Victoria. And Des, would you like to introduce yourself?
Thanks, Talia. So my name is Des McEnany. I'm an international student from Ireland, so I come to Canada. But when I was in Ireland, I worked as a psychotherapist for about 15 years. I've also been a BMDR certified therapist and an EMDR consultant, and I've been a clinical supervisor in Ireland too. I've also been a university lecturer and a family and a workplace mediator. So in terms of coming to Canada, some of my process has been to come here to do a PhD, but also to transfer some of my accreditations. So that takes a while. So I'm a registered social worker psychotherapist in Canada, in Ontario, and I've set up a practice here. And I also work as an EMDR consultant with EMDRIA, which is the body in the US. So equally too, I'm a qualified Flow certified coach as well. So I've just started in the last year or two in terms of my coaching practice, and my intention is to build that too. And so I've gone through the training with Flow as well.
Thank you, Des. And my name is Talia. Some of you know me, some of you may not know me. So I'm a master certified coach with the International Coaching Federation, one of the founders of the Flow Coaching Institute. And also I'm a psychologist and expressive arts therapist. I work with mostly adults, executives, C-level, and the last days more than ever. But in my therapy practice in the past, I worked with children of divorced and separated parents. And I worked with people who are transitioning from loss and grief that may include some illnesses as well, diseases like cancer, into becoming healthy and functioning as a healthy person again. And I worked with indigenous communities in BC as a therapist, as a coach, as a community facilitator as well. But as a coach, as a master certified coach, in the last, I would say, 10 years, I've been a coach for almost 2 decades now. My practice mostly is with organizations, corporations, C-level executives, managers, and helping them to find their flow. Yes. So why we are not there yet? Yes, thank you. So why do we feel a need to distinguish coaching and therapy? What differentiate these two practices? Maybe I start with the ICF's definition of coaching, because for those of you who are not familiar with the ICF, ICF is International Coaching Federation. That is a governing body that decides and determines the standards, ethical standards, and also skills and competencies for the professional coaching. And to become a professional coach, one need to get certified through an accredited organization by the International Coaching Federation. For those of you who may not be familiar, that coaches have to be certified to be called as professional coaches. So there is an education behind it, and Flow Coaching Institute is an education organization. And all the time since I started, this has been a topic. Like coaches, especially that go through an accreditation program, are always very sensitive. They're aware that they're not therapists, and sometimes they're afraid that they may navigate in the waters of therapy, but they're not qualified as therapists. So they always are very sensitive, and it's good to be sensitive and to educate yourself, right? So coaches are not educated in diagnosing and treating problems, and psychotherapists or like psychiatrists are educated and trained to diagnose problems, to give medication, also psychiatrists especially. And whereas coaches, professional coaches, are not problem oriented. We work towards not fixing problems or not diagnosing and treating problems, but mostly we work towards helping individuals to achieve goals, to achieve desired outcomes, to stay motivated, to close the gap between where they are and where they can be. It's almost like becoming a success partner and a creative partner for individuals. So the dynamic of the relationship is different. And having said that, I would like to invite Victoria and Des to contribute to this. Why do you think there's a need to differentiate? Why are we having this conversation, right? Yeah, Des?
Yeah, I think it's very important. I mean, they're two different and distinct professions. I mean, they have commonalities or similarities in the sense that you form a working relationship with somebody, you work with them. You talk about confidentiality, you maybe have a working contract. So those type of things are quite similar. But I think the phrase you used was about swimming in different waters. I mean, the waters can be different, certainly between coaching and psychotherapy. And I think that people in any profession shouldn't work beyond their level of competence. So somebody, in terms of a level of competence as a coach, somebody shouldn't really be straying into the waters in terms of psychotherapy, and that the people should be able to recognize and distinguish what those different waters are, or where the grayness starts, or where those kind of borderlines are, and how to maybe stay in the water that they need to be in to work most effectively as a coach, and equally to be able to help somebody if they do need therapy, so that they will go and see a therapist, and how to kind of bridge that and negotiate that and help that person cross that bridge if they need to go and see a psychotherapist. I think those type of things are quite important, really.
I agree with you. I agree with everything you said. Thank you, Des and Victoria.
Mm-hmm. Yeah, so I feel like there's almost like three categories that I want to talk about, and that is, the first one is what people call life coaching, and those are coaches that have no certification and just decide one day that they're going to be coaches. And one of the things that we've actually noticed is that people will lose their therapy license for doing something they're not supposed to do, and then just change and say they're life coaches instead. And that completely is not okay, obviously, for a whole variety of reasons. But the biggest issue is that they obviously don't understand those differences between coaching and therapy. If they're saying what they're doing is life coaching, that's not the same thing. So I think having that professional coaching does help you to understand that generally, therapy is about diagnosing what the struggle is and trying to address that specific struggle, trying to understand where the struggle came from and how to resolve the struggle. Des mentioned being EMDR certified. I also use EMDR. EMDR in therapy is about treating trauma. So it's not that a coach is never going to say, talk to me about how your trauma has impacted you, but they're not treating the trauma. And so I almost feel like when I'm in my role as a therapist, my role is as a treating clinician. And my job is to help support them in resolving this struggle, versus being a coach. I feel like I'm walking next to an individual who happens to partner with me. And so not so much, there's not as much of a power differential in that relationship as there might be considered in a therapeutic relationship.
Yeah. Thank you. That's a great, what is it, like criteria? I always give that as an example. So therapists are experts in something, right? Like our trauma or like, specific kind of struggles. I like the word struggle, by the way, instead of problem, challenges. And whereas coaches, we are certified, educated, but we are not experts, or we don't claim any expertise in a specific struggle. So it's a different dynamic. And also in therapy, there's a power dynamic. There's, because you treat the person as an expert, you think that the person is an expert, they know about the struggle. Whereas in coaching, maybe we should talk about ICF's definition of coaching here. According to International Coaching Federation, professional coaching is a thought-provoking creative partnership to inspire individuals or maybe groups, teams, to maximize their personal and professional potential. So it's all about the potential, right? And helping them to maximize that potential. So the dynamic of the relationship is different from the very beginning, indeed, from day one. The dynamic of the relationship is different. The agreement is different, right? The needs and wants should be different. There should not be any misleading agreements. Anything that you would like to add here? Yeah. I would like to, before we start to answer the questions, I would like to introduce our upcoming programs. As we spoke about professional coaching and Flow Coaching Institute being a professional coach education and certification organization. We have a variety of certification programs. One is Flow Coaching Core Foundations that has 5 modules. The other one is for people who would like to coach in a business setting, maybe executives, maybe managers. They want to coach maybe executives, maybe managers, maybe business owners. So we have a Flow Business Coaching program that has 5 modules too. And then we have all of our programs lead to ICF certification and accreditation. And ICF identified 2 tracks. One track is ICF Level 1 track that includes 5 modules and an individual mentoring package and oral performance evaluation. At the ACC level, and ACC stands for Associate Certified Coach, which is an ICF credential. And the most advanced and all-inclusive certification track is Level 2 track, which includes modules 1 to 6. It includes 6 modules. That includes the training, mentoring package, and it leads, and also oral performance evaluation at the PCC level. And Level 2 leads to both ACC and PCC credentials. And we also have ICF Expressive Arts Coaching Certification, which is like positioned as a continuing education program the program teaches to gain the skills to coach using the arts, expressive arts. I love it very much. And tomorrow, I think tomorrow we have a business coaching certification training that starts at, I think these dates are, tomorrow we have a cohort starting at 7 p.m. For business coaching. And for the other dates, for other programs, you can check our website, www.flowcoachinginstitute.com. We have the dates on the website, the most updated dates on the website. Wonderful. Thank you. So can we bring the question? Can we start taking the questions? Thank you, Chase. Thank you very much. Yeah. Can we move? Can we bring the next person, please? Pam. Thank you, Pam. Yes. Yeah. Yeah. If you have questions, please ask. Next, please. Yes. Zondra. Yes. How do you communicate to a client who is being coached that therapy would be the best option for them if what they're struggling with is out of your wheelhouse? Yes. Okay. Victoria.
Yeah, I feel like that's a good question because as coaches, we're not giving advice, right? We're not telling people what to do. We're not making suggestions. We're encouraging them to find their own path. And we just, like we talked about, walking next to them. But I do think there's space for us to be honest with our clients and say, this is outside of my wheelhouse. And let's talk about what some options are, like places that might be helpful for you to go in these circumstances. And I say it that way because in some cases, we do want to encourage therapy, but in other communities, there may be alternative supports that they can access through a church or religious organization or something to that effect. So I feel like the important part is saying, this, I would love to support you with this if I could, but this is not within like my scope of our relationship. So even among those of us who are both therapists and coaches saying, this is outside of our relationship. And so let's talk about what relationship you can get into with someone else who can support you with that.
Yeah. Thank you. I mean, even being a therapist, doesn't mean that you will work with all kinds of struggles, right? You will work with all kinds of people. It doesn't mean that. Everyone has their specialty and expertise. Des?
So yeah, I very much agree. I mean, for me, it's not working outside your competence, but I think you need to be able to have those honest conversations. And I think I don't want to use the word dangerous, but I mean, that's the word that comes to mind. I think it is dangerous for coaches maybe to go into areas that they shouldn't be going into. And that's not to kind of perfect the professions as such. Well, maybe it's partly that, but it's more to protect the client, that the client or the person that's come to coaching gets what they need through therapy, and that therapy should be presented in a positive light, and that there's no kind of stigma attached to it or nothing negative attached to it.
Mm-hmm.
And that it may assist the coaching process if a person needs to go to therapy to get certain issues resolved where they're stuck. So that I think the two can complement each other really in terms of therapy and coaching.
Mm-hmm. Mm-hmm. Yeah, thank you, Des. I mean, I really like how you framed it. Like therapy should be presented in a positive light. Years ago, I had a client, and it was a coaching client, a young person in his 20s, mid-20s. And then sessions were like, the sessions were very creative, and he enjoyed working with me. But in between the sessions, he didn't commit to what we discussed. And then sometimes he would come as the sessions were in person, I should say that too. He would come as very with low energy. And then sometimes he would come with very high energy. And then I knew there was something, but I I didn't know how to present it to him without upsetting him. And he was from a very wealthy family, and for the family, he was like this spoiled, uncommitting child. They didn't take him to a therapist before. They didn't take him to a psychiatrist before. And I really struggled. And because I can't diagnose. So, but I knew there was something. So I opened the conversation in a way like, I said, did you work with a psychiatrist before? Like, did you have he said, no exposure, not so ever. And then I told him that, so this is what we have been experiencing. And I offered him maybe a psychiatrist and psychotherapist would be more beneficial, like their service might help him better. So he was so upset. And I did my best to frame it in a positive light as much as possible. But there are so many stigmas, so many perceptions about therapy still to this day. These sessions were 9 years ago. And a lot of people think that, when they work or refer to a therapist, oh, there's something wrong with them, even jokingly sometimes. So maybe having, just in case, thinking about projecting about if you have a client that you would like to maybe refer or tell them that therapy or other specialists might be more effective in the process. Maybe think about how you will present it, beforehand, even when you don't have any clients like that. Because sometimes you start the relationship and then along the way, you realize that something, as you said, is out of your wheelhouse, but also something is different. So, and I did my best, but still he was very upset. And then a year later, he sent me an email this long, and he thanked me. And then he asked if I could recommend him anyone in Toronto, and I did. And then he started therapy, and he got a proper diagnosis, and then he was on medication, and then now he functions better. So, why I'm telling you this story, even so I was a practiced and experienced coach when this happened. I had a 12 years of coaching practice, and I already had a therapy practice also. Even when you have this much experience, not everything is within your control. So, and to be okay with that, if you decide to work with people, these things are normal. You can't control their perceptions, right? So don't be afraid of, but just be respectful, be gentle, respect their boundaries, respect their dignity, and then do your best to present it in a positive light. Thank you. Francois, more about the red zones where coaching ends and therapy begins, especially in the realm of business coaching, if possible. I've got hundreds now, and studies avoided going near that board, but I can tell some leaders oh, okay, how can I partner with them without crossing the line? That's a great question. Thank you, Francois. Let's start with our guests. Can we keep that question because that question is a bit long? Can we bring Francois's question, please? It's okay if they don't see me, so, because the question is long, so I really want our audience and guests to see the question. The red zones where coaching and therapy begins, especially in the realm of business coaching. And yeah, first of all, maybe I start and then Victoria, and as you speak, as you think, maybe I start. So, Francois, hi. There is this misperception in coaching among the coaches, among professional coaches. And they sometimes perceive that, and I witnessed it with a lot of coaches since I mentor, coaches. Sometimes they think that even talking about emotions, asking questions about feelings are the realm of therapy, is the realm of therapy, which is not the case. So we can help the clients, coaches to become aware of their feelings, of their emotions, of their bodily sensations even. We can ask, how do you feel it in your body? How do you feel about this? And can you describe this feeling? We can ask such questions. So that's still coaching. That's still coaching. And what is not coaching is that when you start to analyze, what I mean by that is, so let's say clients shared a struggle with you. Let's say conflict is a struggle for them. The workplace conflict is a struggle for them. They can't face, they can't confront, or they shut down. They can't speak out. They can't express themselves when there's workplace conflict. And then as a coach, you want to help them, and you can ask questions like, what is the impact of this in your body? How do you feel about this? So instead of feeling like this, if you were feeling differently, what would that feel like? What do you do about it? This is still coaching. Whereas when you start to ask questions like, since when you have been feeling like this? Do you remember the first time you started to feel like this? So that's analysis. So we don't do that because there may be a trauma, and we are not trauma experts. There may be something that we are not maybe abused. We don't know. So we don't dig the past. That's the red line for sure. That's the red zone for sure. And everybody just also being okay with those feelings. We're all humans. So everybody has some kind of trauma, by the way, everybody. That's one of the facts of life. And sometimes just coming to your second question, like I can tell some clients leadership management of their teams at work is affected by their past experience or trauma. How can I partner with them without crossing the line? We may assume that it might be related to past experience or trauma, but it may also be their personality. It may also be their skill level, lack of skills. It may be also competencies. It may be some thinking habits. I think the best way is for me to reflect on the impact and awareness piece. But that's a long process, which is great. maybe I talk too much. Maybe I should ask Victoria and Des. So sorry.
No, you're fine. I should preface this by saying that I say all the time, when I'm the queen of the world, everybody has to go to therapy. Like, that's going to be one of like my first edicts in life, because I think that everybody benefits from therapy, even though there's a very specific, the way that we operate therapy, particularly in the US and I believe in Canada as well, it has to be medically necessary and there has to be a diagnosis and all of those kinds of things. I should also preface this by saying, as a business owner and a supervisor of employees, I always say to err on the side of caution. So if you think you're nearing the red zone, just stay away from that. Go as far away as possible. But I think what Talia said is what came into my mind, which is, what are we doing right now? How are you feeling right now? What can we do to fix right now? Versus what's happened that got us here. So if you're talking with a coaching, one of your coachees about why they're having this experience right now, or what their experience is, that's very in the realm of coaching, even talking about, well, I feel frustrated or whatever. But when we start getting into, well, this guy reminds me of my dad, now that's a therapy thing that we want to refer out, right? We want to move that person back to their therapist that's outside of our scope as a coach. And so for me, some of it is being very aware of, what time period are we talking about? Am I talking about right now, or am I talking about the past? And while in therapy, we often talk about the present, because there's lots that we do within the present, that past really does have to stay in the therapeutic realm, at least.
Yeah.
In my opinion.
Yeah. Thank you. And Des?
Yeah, I think it's a really good question. I know it might be a bit long, but I think it's very perceptive. And I think the piece about, but I can tell some clients' leadership management of their teams at work is affected by past experience of trauma. Francois is clearly picking up on something. And I think they're very kind of perceptive and observant. And I think there needs to be, like what you said, Talia, about it's okay to talk about feelings and to move into that area in terms of collecting information, but not by way of a therapeutic diagnosis, but by way of some kind of understanding. And in terms of turning it back on its head a little bit, if the goal is to be more effective at work in terms of leadership or management of teams, it's advantageous for the person then, maybe through kind of an honest conversation or conversation with candor, that the person might address those issues then through therapy, because that in turn then may help in terms of their leadership or management at work. Because I would assume that those kind of issues are clearly causing some level of distress for the person as they try to manage the teams and try to lead the teams, if maybe the past keeps on spilling into those kind of present day interactions. So I think it's good to have a very kind of honest conversation about that. But I like the way the questioner is very perceptive and intuitive about this, and is trying to kind of tread carefully. But I think in the treading carefully, you also have to kind of be willing, to be brave enough to take the step to talk about these things, not to diagnose them, but to collect information and to help the person then get therapy and then be more effective in terms of their coaching, in terms of leadership and management. Because I would assume that that's part of their goal in terms of some of the business coaching.
Mm-hmm. Thank you. And just to add to your points, and so we don't tell clients, Francois is very resourceful, I know him, he wouldn't do this, but we don't tell clients that might be what they're going through right now, or their protective behavior, or the kind of behavior, whatever it, abrasive behavior, I don't know what it is, might be a result of their past experience. We don't say that as coaches, but what we do instead is, so what I have been observing is that you have been really not giving enough space to your teams, to your people, to your individuals. As a coach, we can share such observations by respecting boundaries, by respecting the dignity. And then, I wonder if you would like to discuss this. I wonder what kind of a leader they see when they look at you. So really focusing on creating awareness by bringing different perspectives when that happens is the coach's job. Versus digging and trying to focus on that. And if you are a strategic partner for the organization, for the corporation, and able to bring other stakeholders There are organizational psychologists and there are therapists that, are specialized in working with such cases, Francois. I'm not sure if you're in a position as such, but, that's a resource too. Wonderful, thank you. So another question, please, Osho. Hi, Osho. As a coach, when should I recommend my client to go to a therapist? It's such a broad subject, right? Their possibilities are too many. That's why it's a. But let's start with maybe a few examples. Des.
I think it's in terms of what's observed. I mean, you talked a little bit about it earlier on, Talia, and the example that you gave. So in terms of what you observe about people in terms of their energy, maybe over different sessions, or the type of things maybe that they talk about, or if somebody is reverting maybe to past difficulties, like maybe getting stuck in past difficulties, or feeling like a victim in some way, or if somebody's ruminating on a particular situation, maybe in terms of something that's happened in a family situation or a divorce situation, or maybe where they got fired, so that there's a continual circling around and around and around, and almost like a tire kind of in the sand that goes around and doesn't progress, or that the person comes in and identifies goals but gets stuck in this kind of previous kind of victim type cycle. I think those are instances for me, certainly. So you look for the physical observations, but you also listen in terms of what's verbally told or what's verbally said. Then I think maybe there's something more than coaching is needed, or something different than coaching is needed, I think, really.
That's very useful. Thank you. Yes, and Victoria?
I think it's a hard question because I don't know that there's a super clear answer, right? Like it's more of I have to be aware of myself, aware of my gut instincts, aware of when I feel out of my depth with someone. Is it that we've been doing the same things and going round and round and round? Is it that I feel, one of the things I talk with my staff about is how do you feel about going into a session? If you feel frustrated going into a coaching time with a client or a coachee, why? Let's talk about that. Let's see if that's, what that's about. And so I think that for me, it's really about understanding that when you know this is not for me, and that means you have to be really aware though of yourself and your own role, and not wanting to overstep, not becoming that person that, well, we want to be a helper because we want to help people. We have to remember we're also nobody's savior. And so we are not going to be the end all be all for any person, whether we're a therapist or a coach. And so we have to remember, in my role as a helper, is this out of my realm? And so when it becomes that, then we say, okay, now we've got to talk about some other things. What are some other options besides just coaching?
Thank you. That's great. I hope this was helpful for you, Osho. And also maybe give it at least like 3-4 sessions. See the client at least 3, 4, 5 sessions to be able to observe if there's progress or if there is some momentum happening. But sometimes the conversation might go very awkward in the beginning. Then you know that you're not the coach for them. You don't have to refer them to a therapist because that's not within your expertise. But that when you know that you're not the coach for them, then don't engage in the relationship. Thank you. And next question, please, Shasta. Hi, Shasta. How long can coaches continue to coach? Thank you, Francois. Thank you, too. Thank you. Yes. How long can coaches continue to coach if they don't see results? I think we kind of answered it maybe, right? I think we answered it. I mean, there's not one absolutely correct answer to this. It's very situational with each person. I had a client years ago, one of my earliest clients indeed. I coached her for about a year, maybe 16 sessions, 20 sessions, I can't remember, but it was a year engagement. And she was she had some goals, but throughout our relationship, she didn't give the decisions that were aligned with what she wanted to create. She didn't make those decisions. And I waited and I kept the relationship and I kept coaching her. Then we had conversations about that also, because one of the things is really to be very honest, with your coaches. And then again, a year later, I think a year later, after our last session, a year later, she sent me an email. And she said, thank you for being very patient with me. I know I couldn't, take the actions and make the decisions. I wasn't, I didn't have the courage. I didn't feel empowered. But then she listed all of the decisions that she made after our relationship ended and the actions that she took. So that's why it's important that we stay curious, right? And open-minded. Anything that you would like to add to that, Victoria? Yeah.
I just wanted to say too, if people are familiar with the stages of change, we say that there's 5 stages of change. We have to remember when we talk about seeing results, we have to be thoughtful about what we mean. So people don't just change. They don't just wake up one day and say, I'm going to do something totally different. They have to go through this process of like psychologically preparing for that change. So to me, it's do I see movement, even if I don't see the results I want to see? Am I seeing movement in this relationship, or are we stuck? Are we not making any movement? If we're not making any movement, that's a different story. But really being aware of what do I mean when I say results? Because if I'm only looking at that end goal, then I'm going to struggle, because change doesn't happen that way. So I think understanding that piece too.
Yeah. And can you, I'm sure now in our audience, there are people who are not familiar with the 5 stages of change. And now you mentioned that I'm sure they're curious. Can you tell us about it? We have time. Yeah.
Sure. Yeah. So the 5 stages of change came out of motivational interviewing. I think originally actually with substance abuse, people who were being treated for substance abuse issues. But I like to use the example of going to the gym. So if you are in the first stage, which is pre-contemplation, I don't have a problem, I don't need to go to the gym. That's not an issue for me. So pre-contemplation is that first stage. Contemplation is the next stage. Maybe I have a problem. Maybe I should go to the gym, but I'm not going to do anything about it. I don't really care. Mm-hmm. The third stage is preparation. So that's when we're actually getting ready for the change, which to me actually generally is a very long stage. But that is the stage where we go, okay, I'm going to go buy the clothes. I'm going to sign up for a gym membership. I'm going to talk to my partner, and I'm going to try to find a workout buddy. And then we go to change, which to me is actually the shortest portion. That's when I actually go to the gym. And then I have this maintenance stage. And that's where I maintain the change that I've made. In some cases, people will add a 6th stage, which is relapse, right? Because then we go to the gym for a year and then we fall off. And we have to go back to that preparation phase and start again. But we understand that relapse is part of the process. Yeah. So those 5 stages, pre-contemplation, contemplation, preparation, change, and maintenance, are actually a super important part of understanding how we can notice progress even when it's not as clear as, I'm going to the gym and I've lost 50 pounds. That's a great goal to get to, but you're not going to come to me and tomorrow you're going to have lost 50 pounds. Yeah. We have a lot to walk through.
Yeah. Thank you. Des, anything that you would like to add?
Yeah, I agree. I think that's a very useful model. I think change is very gradual. And I think too, it's all the going to the gym, and bit by bit it takes months, and then all of a sudden the change is visible. It just doesn't. It seems sometimes to happen overnight, but it's the work that's all the time being done prior to that. I think too, I'd be focused on the word results. Like what does the word mean? Like is is it the coach's view of what the result is, or is it the client's view of the person coming to coaching? And what does the result actually look like, or what does it mean, or how is it looked at, evaluated, thought of, measured, all those type of things. So there's a certain amount of subjectivity, I suppose, in that, really. So
Thank you. Yeah, thank you. Well, when the coach realized that the client needs therapy rather than coaching sessions, what are the right words to explain this to the client without giving them the feeling that they have a serious mental problem or that the coach is unwilling to help out? I think we touched base for a bit, but just maybe reflect for a bit as well as a team. Let's think about it. So I think we answered this question. What do you think? Des, do you think we have answered the question?
I think we have largely, or I think we've certainly given a good explanation of it, but the person is asking about what are the right words. So maybe they almost, well, I don't know if they want a script, but it almost sounds that they want to be quite careful or quite sensitive or diplomatic in terms of what are the type of things that they say. I think maybe that's what they might be looking for in the question. But I think other than that, I think we have talked about it and explained it.
Mm-hmm. Mm-hmm. Yeah. Can we go back to the question, because I want to, yeah. Victoria, what do you think?
Yeah, I think unfortunately there's not the right words for that would apply to everyone. So certainly in some of my coaching relationships, I would say very honestly, and very directly, like, this is what I observe, this is what's going, this is what I observe is happening. Where in other cases there does have to be quite a bit more diplomacy and quite a bit more, engagement and conversation and softness and gentleness. So I think it depends. But I think the important part is that as a coach, we are always honest. We may be more diplomatic or we may be more confrontational, but there's always honesty. There's never lies. There's never avoidance. There cannot be any type of fear on the part of the coach. It has to be that we are willing to be honest. We're willing to have the hard conversations, because people have other people in their life who can be, very nice and say, oh no, I love that outfit. They don't need to pay us for that, right? They don't need to come to a coaching session for us to say what everyone else is going to say. They come to us because they know we're going to give them honest feedback and have honest conversation with them.
Thank you, Victoria. And thank you both. Maybe a few things. So we shouldn't say any client that they might have a mental problem. That's a red light, it's a big, big, big no. We shouldn't say that. We might have some assumptions, but remember, it's just an assumption. We may not be right. It might be a personality thing. We don't know. Okay. It might be a temporary thing. We don't know. So we can, so we don't say that. But instead, we can say, I've been observing this and this. And I feel like we are not making progress. And I wonder if, there are other resources and specialists that would be more effective in our situation, in your situation, because maybe it's me, my coaching style, that made me think that we haven't been able to make progress. But before you have that conversation, just ask them, how do you experience progress? Just ask them about this question. How do they experience progress? And then have this conversation about them, and then see how the conversation goes. And since apparently you're a very careful and observant person, like cautious person, I'm sure you will handle the conversation very wisely. Thank you. Does Flow Certified Coaching equip us with tools to coach? Yes, we do. That's our job. Our job is to give you the understanding, the knowledge, information, and tools and techniques and methodology and structure to become a competent, confident, professional coach, and also align your skills with the standards of the International Coaching Federation. That's what we are here for. Difference between coaching and therapy. However, in my opinion, coaching can provide psychology as even friendship often can, in cases that do not involve medical or mental conditions. So coaching is also psychological support. Is this statement correct? I think it's correct. It's a psychological support. It's not, everything is about psychology. It's not therapy. Coaching is not therapy. Coaching is the psychotherapy. But still, it's a psychological support because everything, the whole life is about psychology, if you ask me. Everything. All of our functions, I would say, how we wake up every day, how we go to bed, like, the mood, everything is about psychology, if you ask me. Victoria and Des, you're smiling. I see your smile.
Yeah, I think you're right. I think it's a good question though, because I mean, people talk about things like psychological first aid. So after kind of after a traumatic event, sometimes people think that there's a need automatically to throw in a therapist or a psychologist or a psychiatrist, but psychological first aid is just about making sure that somebody gets sleep, or that they eat, or that they have shelter, that they have water, that they have warmth, and it's like Maslow's hierarchy of needs. It's a very kind of important stuff at the bottom of that kind of triangle. So psychological support. Yes, I think it is correct in terms of what's been asked.
Yeah. Thank you. I agree. And can we bring the next question? Yes. The answer is yes. We all have it. And when working with clients, how do you draw that line? Would you ever offer both services to the same client? Victoria, I think that's a good question for you.
Thank you. I will say no. Yes, you can have a psychotherapy practice and a coaching practice. No, I would never offer both services to the same client at the same time. And the reason is because of that power differential, what my job is, what my role is. That gets very confusing. Even for me as a therapist, this is my therapy office that you see behind me. When I'm doing coaching, I actually try to do it in a different space. I either use a different office or elsewhere, because I want to make sure my mindset is in the right place, where I'm not the expert now, I'm walking next to you. And so for me, again, it's what does the client present with? Sometimes it's how does the client ask for services? If they call and say, I want to see a therapist, then they see Vicky the therapist. If they want to see a coach, then they see Vicky the coach. And if the service I'm offering them is not the service they need, then I refer them to someone else, because now I've established a relationship with them. So if they came in to see me as a coach and then said, oh, I think I need a therapist, can you see me as a therapist? I would say no, but I'd be happy to offer you some referrals if they ask me. As Talia has mentioned, we don't make those kinds of suggestions. We don't make those directions. Even if we have that in our other wheelhouse, that's still not our job as a coach. So to me, it's really up to the client. But I personally think that creates a lot of gray area for clients if we are trying to provide both services. And that's also really confusing for us as professionals.
Thank you. Yeah. And do you want to add, Des, or?
No, I agree. I'd feel exactly the same. I think it just creates far too much confusion for not alone for the client, but also for the therapist coach. I think it's good to keep your boundaries very clear.
Thank you. Wonderful. And maybe next question then. Just want to know how to navigate from coaching to therapy. Thank you, Isabel. From coaching to therapy. Des,
I'm not sure what the questioner is asking. Is this kind of in terms of maybe professional accreditation? Maybe that's what the questioner is asking. Or are they asking from the client perspective?
I think it's from the client perspective.
Okay. I think, yeah, I'd need more context, or I need more information in the question, I think, to answer that, to be honest. And I think we may have already answered it in terms of does the client need to move from coaching to therapy? I think we've kind of sufficiently answered that already.
I agree. I think we have answered that, yeah, with some examples even. Yeah. Thank you. Is there a governing body that sets out the legal and ethical standards to which coaches must adhere? If so, are the standards international? Yes, there is a body called International Coaching Federation, like ICF, as you mentioned as well, the card. And it sets out, but coaching is not governed legally. Maybe I should. In some countries, but in some countries it is. So, for example, in North America, it's not governed like, psychotherapy legally from a legal perspective. Whereas, for example, in Australia, it's governed legally. You have to you have to register yourself. That there is law. And I know through our coaches in Australia that they have to become registered. They have to have the license. So really, the International Coaching Federation is recognized internationally as a body that determines and sets the standards. And yet, depending on where you live in the world, I would recommend to check the local system to learn if it is governed, or if there's a law. Like I know in Turkey, for example, there is law. It's coaching is recognized as a professional occupation, and there are some standards. So really, from country to country, there may be differences. So check out the local standards and local law. I think, do we have any? I think, yeah, I think we have covered all of the questions. Wow! Yay! I'm so proud of us. Okay, wonderful. So we are, I think we are done with all of the questions that we have received. And if you want to further contact with us, here is our website, www.flowcoachinginstitute.com, to learn about upcoming programs, or get in touch with us, or maybe ask questions, review our blog. We have very useful information on our blog. And thank you, Lana. Thank you. And we will continue with other topics, and maybe in the coming months we can host Victoria and Des again. Thank you very much to both of you. I really enjoyed, and also you're both very experienced, and thank you for sharing your wisdom and expertise with us. And for now, bye everyone. Bye.
Thank you so much.
Thank you.
Thanks.